Today's video, how Germany's universal healthcare system works.
We are Lisa and Greg, an American couple living abroad in Spain. If you are curious about the crazy, funny, and surprising differences between the US and Europe, you came to the right place. We are inching closer and closer to 10,000 subscribers, so go ahead and hit the subscribe button. I mean, you might as well, so you can be one of the 10,000. All right, so this is CNBC, and I always assume that everybody knows who they are.
Yeah, but I don't think they do, because I think it's a US channel, or, it is a channel on television. Yeah. They obviously have a YouTube.
But they have a cable network, so people probably know. This isn't usually a cable network.
Oh, okay, yeah.
Because it's usually NBC.
So it's big in the United States. I don't know if it's big out here.
Yeah.
But yeah, we know that each country has its own healthcare system. And so hopefully this dives into actually how it works here in Germany. Okay. We're not there.
We're not there yet.
We're not there.
All right. And of course, we'll still include a link in the description, because you might as well go and show them some love and get them up to 4 million. So, all right, let's take a look. I'm sure they would appreciate it. That's why they have a channel. Right,
yeah,
let's see what we got. You ready?
Yeah.
All right.
70% of Americans say the U.S. healthcare system is in a state of crisis, or that it has major problems. That's why we're hearing a lot about Medicare for all, including some plans going as far as banning private health insurance companies altogether.
On page 8 of the bill, it says that we will no longer have private insurance as we know it. And that means that 149 million Americans will no longer be able to have their current insurance. That's in 4 years. I don't think that's a bold idea. I think it's a bad idea.
Problem, Senator Sanders, with that damn bill that you wrote, and that Senator Warren backs, is that it doesn't trust the American people. I trust you to choose what makes the most sense for you, not my way or the highway.
One country found a way to provide universal healthcare coverage while maintaining a competitive insurance market that offers citizens more choices. Germany. Here's how they did it.
Let us know, too, because this video is 5 years old. So we know a lot can happen in 5 years.
A lot can happen in 5 days, 5 months.
That's true. So, maybe things have changed for the better or for the worse. I don't know. Yeah. So let us know if this is at all different.
Yeah.
Okay.
More choices. Germany. Here's how they did it. In 2017, U.S. healthcare spending came to around $10,200 per capita.
Okay.
Oh my gosh. Okay, Germany's right down there with them.
Mm-hmm. Well, Spain. Not right with them. They're further back.
Yeah, that's true. That's true. Yeah. So. Okay.
In Germany, it was a little under $6,000. Overall, Germany spent about 11.2% of its GDP on healthcare, while the U.S. spent 17.1%. Germany manages to cover 100% of its population.
Isn't that funny? Like, they spend more money, a percentage of the GDP, but they don't have universal health care.
I know. I don't know.
That's weird.
We'd have to watch a video about the United States to see where the U.S. is putting their money, because honestly, we don't know.
Yeah.
Where it's going, because it's not going to the people. And the next slide just shows that that money is not going to 100% of the people.
Right.
0.1%. Germany manages to cover 100% of its population. In the United States, about 8.8% of the population remains uninsured.
You know why that number's so high, that 91.2%? Is because of the Affordable Care Act.
Right.
Which a certain party in America wants to get rid of.
Yeah.
Anyway.
Right. Wonder what it was prior to that.
Yeah.
Yeah.
It had to be a lot less than that.
A lot less.
Population. In the United States, about 8.8% of the population remains uninsured. That comes to about 28 million people, with even more people underinsured. Despite spending less, Germany has better or...
Did you hear what she said? More people underinsured?
Underinsured. And that is a big deal, too. So that number may look amazing, like, well, wow, 91%. Yeah. But if you're underinsured, you're basically still getting all these... exorbitant bills. And so it feels like you don't have health care, even though you have it.
Right. Or you're underinsured. I mean, then you are afraid to use it, because that means you're coming out of pocket with a certain amount of money and you don't have it. And so it's like you have health care, but sort of not really. It's like you have a car insurance with a $10,000 deductible, so you might as well not even have car insurance.
And there's a possibility, which is common, super common in the United States, where the insurance company will deny it.
Yeah. Dang, that is so true.
Yeah.
Or comparable health outcomes to the United States. Studies show that in Germany, there were fewer deaths that could have been prevented with proper access to care. In 2013, there were 83 avoidable deaths out of every 100,000 people in Germany, while the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States. The infant mortality rate is lower in Germany, with 3.3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States. Additionally, the maternal mortality rate in the United States is more than 2 times higher than in Germany. So how does Germany manage to have better health outcomes while spending nearly half as much as the United States?
Yes.
Germany is a system that would look familiar to Americans in that everybody buys health insurance from a private company. And then the doctors and the hospitals and the labs are almost all private.
That's T.R. Reid, author of the book, The Healing of America. He traveled.
That's interesting.
That it's all private?
Yeah.
I didn't know that.
They're all private. So,
Private.
That's T.R. Reid, author of the book, The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
But it works better in Germany for a couple of reasons. One is everybody is covered. Everybody is required to have insurance. Everybody's in the system. The insurance companies can't turn you down because you had cancer last year or something. They have to take you. They have to cover you. Everybody has access to the same treatment, and all the doctors. You can go to any doctor without any limit set by the insurance company.
In Germany, health insurance is mandatory for all citizens and permanent residents. There are 2 different systems that residents can turn to for insurance: SHI, which stands for Statutory Health Insurance, and PHI, or Private Health Insurance. German citizens are eligible for PHI if they make more than roughly $60,000 per year, or if they are self-employed. Citizens making under that threshold must pay into SHI. SHI is made up of a network of competing not-for-profit private health insurance funds, known as sickness funds. In SHI, dependents are covered free of charge, and monthly costs are capped around €840 per month. Even though SHI sickness funds are not government agencies, many Germans think of them as part of a public system because of heavy regulation. Keith Tanner helps expats navigate the German healthcare system, and he considers SHI sickness funds quasi-public organizations.
Basically, they have to do what they're told. They are told by the government in what range they can charge. They're told what health procedures they can fund. And they are told by the government who they can accept as clients. So they're really just carrying out orders.
They're basically charities. They don't exist to make a profit for investors like American health insurance companies. They're there to keep people healthy. That's what they're there for.
It's good, and that's a huge difference, and that's where it becomes a problem when you start getting into profits. When they're not worried about profits, then no matter which one of them you go to, you're going to get the same quality of care, treatment, prescriptions, everything.
Yeah.
In America, it's about profit. So if a doctor wants to make more money, they're going to go to a certain organization because that organization pays more. They're going to charge more, and so it just falls apart.
They're going to recommend certain things more. Yeah. I mean, there's movies about this in America where there's doctors who are shady and prescribe medication because they get a kickback from it, or stuff like that. So they it's nice that they're mandated so they don't become an organization of profit. Right.
Health insurance companies, they're there to keep people healthy. That's what they're there for. They follow all.
Imagine that. The nerve.
Gosh.
Keep people healthy? Why would they do that?
They're there to keep people healthy. That's what they're there for. They follow all sorts of rules that American insurance companies wouldn't dream of.
The system is funded
Right.
through compulsory contributions based on a percentage of citizens' salaries, with employers sharing the costs. There are also built-in safety nets. The government will pay into SHI on behalf of the long-term unemployed. Despite being nonprofit organizations, sickness funds compete for customers by offering specific coverage and perks. This competition has changed over the years as the system has allowed citizens more choice. As of 2019, there are about 100 statutory health insurance companies, but there used to be many more. When Germany's system was first established in the late 1800s, sickness funds were linked to a person's profession. It used to be that people were assigned to a specific sickness fund based on their occupation or region. Now Germans can choose where they enroll, and they can change funds on a yearly basis. As a result, sickness funds began marketing themselves in order to retain customers and attract new ones. This also led to the funds merging, so they could become more competitive. Some of the sickness funds offer perks that might seem similar to credit card rewards.
You still can get a bonus for going to the gym, and a bonus for having a checkup. This is in the public system. And if you get a certain number of bonus points, then you get a voucher. But kind of trivial stuff like 200 a year or something like that, 200 euros a year, nothing which is particularly relevant to the person who's paying their 840.
There's some insurance company that offer that in America.
Is it through Medicare or?
It's through their insurance company.
Oh.
But I'm thinking of Medicare, but the private insurance companies in Medicare are funded by the government.
Okay, they might offer
incentivize you to use them by saying, if you go and you go to the gym, if you get an annual checkup, you get a certain amount of points, and all these points add up to things that they can use to purchase stuff.
Oh, okay.
Yeah.
I don't think I've ever experienced one that gives you something at the end of the year as a perk.
Yeah.
I have heard of like the free gyms or reimburse you for the gyms.
Right,
a lot of times they'll just reimburse. But yeah, and most insurances, they cover preventative care.
Right.
Like the checkups and stuff like that, but they don't give you anything in return.
Right.
Which is particularly relevant to the person who's paying their 840 a month.
As of 2017, roughly 87% of Germans received their primary coverage through SHI and 11% of the population through PHI. The remaining population, such as soldiers, police officers, and refugees, receive health insurance through specific government programs. All individuals insured through PHI pay a risk-related premium with separate premiums.
I think PHI was a private health insurance.
I think so. And just so I understand, they're paying $800?
That's the most they can. They would have to pay is 840. I think it was 840.
Okay, because that is kind of high.
Yeah, but I mean, I would have gladly paid that.
Because we were paying $1,000 for the both of us, but
and then we still had to pay $22,000,
and it was
for
crap.
just a procedure.
Yeah.
So I would happily pay $840 if
everything's covered.
Yeah, that's what they're saying.
And that's what they're saying.
That everything's covered. And here's one of the sticking points with the Affordable Care Act. The lack of a better way of saying it, a certain party has labeled it as Obamacare, but it's called the Affordable Care Act. One of the problems with the Affordable Care Act is that they try and mandate that everybody have insurance. And so if you don't have private health insurance, then there's a penalty that you would receive. So that's where
during tax time.
Right.
So you pay that when you pay your taxes. So during our tax time, we are asked if we have insurance, and if we don't, there's a penalty.
There's a penalty. And so that's where people get, it's America. So in America, like, you can't tell us what to do. You can't tell me that I have to be healthy. What's wrong with you? If I want to be unhealthy with no insurance, I should be able to do that. I'm not, obviously I'm being facetious. That's not what I believe.
Right.
But anyway, I just want to point that out because that's what they were just talking about.
For each dependent. These risk-based premiums mean that costs will increase as the insured gets older. As a result, the government regulates PHI so people don't become overburdened by premiums as they age.
The biggest issue with private health insurance, if you opt out of the...
I'm sorry, but that is so good because I was selling Medicare. I've probably said this before.
Which is for the elderly.
It's for the elderly.
In the United States.
Right. And the government covers 80% of the cost. If you just have Medicare, the government covers 80% of the cost. And then you, the insured, are responsible for the additional 20%. Mm-hmm. And those people will get a Medicare supplement where they're supplementing the amount that they owe. And what ends up happening, those supplements are based on your age and some other factors. So the older you get, the more you have to pay. I mean, it's nice because everything's paid for, but you might start out paying $200 a month, $300, $400 a month, $500 a month for that extra supplement. So,
and what people don't recognize either is a lot of times it's taken out of their Social Security check.
Yeah.
So they're just getting less and less money. It's a good way for them for it to get paid.
Right.
But they're just, their Social Security. And as you're getting older, you don't even realize what's happening.
Right.
Your Social Security check just keeps getting smaller and smaller.
Right. Well, I mean, oftentimes what will happen is the people who pay that Medicare supplement, they have money.
Oh, really? Okay.
Yeah. And so then you run into the situation of the haves and the have-nots. The people who have money can afford it. The people who don't, they have to pretty much exhaust all of their funds, and then they can get on Medicaid, which is, basically your award of the state. So that's just a hot mess.
As they age.
Yeah.
The biggest issue with private health insurance, if you opt out of a public system, is affordability in old age. If you don't impose these financial constraints on the insurers, then the government will be lumbered with a whole lot of old people who reach 85, 90, 95 and are going to be totally unable to pay for their health insurance. So it'll all fall back on the government.
Once someone switches to PHI, they cannot switch back to SHI in the future. But Tanner says there are ways around that.
If you're a freelancer in the private system, you're just going to get a job. Paying less, there's a threshold. Any employee earning under about $5,000 a month is required to have public. If they earn more than that, they can opt out. So if you are a freelancer, you want to go back into the public system for some reason, then you get a part-time job with a friend, pays you $500 a month for a few months, and then you're back in the public system. So don't waste it. The only reason you probably want to do that, though, is if you have lots of children, because children can be covered free in the public system. In the private system, you have to pay separately for each child.
Germans can also buy supplemental private insurance while staying in SHI. For example, many Germans buy supplemental dental insurance.
The public system pays for major dental work about half the cost, and then you get supplementary to take it up to 80, 90% of the cost.
Germany's system is not perfect. With so many different insurance companies, there's a lot of bureaucracy that contributes to costs.
One of the financial things, thinking if the public system administered by more than 100 organizations called Krankenkasse. Each of those has a head office and a president and a vice president and a financial officer. A whole lot of unnecessary bureaucracy.
This may be one of the reasons that the German system is not as cost-effective as other European countries. More than 30% of both Germans and Americans felt bureaucracy was a major issue in their country's system. Wait times can also be an issue for people in SHI. 37% of Germans cite wait times as one of the biggest problems within their system, while 22% of Americans feel the same.
Generally, I think people are quite happy with the public system. It works reasonably well. The major issue in big cities, I'm in Berlin, Munich, Düsseldorf, Hamburg, it can take quite a while to get an appointment with a specialist. It is the case that the doctors prefer the private patients because they earn up to 3 times more if they see a private patient.
So what?
Man, that's a tough one. And that is one of the biggest arguments that the opponents of a universal health system have in America is the wait time.
Right.
And I don't know. I mean,
it's a complaint here in Spain, too.
It is. But I just think of the people that are 70, 80 years old. Like, for them, it's either long wait times or you don't see a doctor and you die. And that's just, are you unalived? I don't know. This is YouTube. I don't know if you're allowed to say that. But I mean, basically, that's how it works. It's like it's one of those two things. And so I would rather my mother or me one day I'm not going to be in America, to have the option of taking 2 months to get an appointment as opposed to just dying because I can't get an appointment in 2 months, 3 months, 4 months because I can't afford it.
Yeah, because at least you are going to make it the appointment. Here in America, they just don't make it because it's more. There's other reasons like you can't afford.
They're in America.
They're in America because they can't afford it. So that I don't know. I guess I'm getting into something else, but go ahead.
They earn up to 3 times more if they see a private patient.
So what can the United States learn from the German system? Germany has managed to balance cost controls and universal coverage while also maintaining competition. And Germans generally like their system. In one survey, not a single German said they had to wait more than 4 months for an elective surgery, while 4% of Americans said that they had to wait that long for the same kinds of procedures. And only 7% of Germans said they experienced a barrier to care because of cost in the past year, compared to 33% of Americans.
Yeah, exactly.
That's super interesting.
This is what I was saying.
Oh.
That I was trying to say, but it wasn't the right time to say it. But yeah.
Okay.
So the barrier of going to the doctor because of cost is there in the United States.
Right.
Had to wait that long for the same kinds of procedures. And only 7% of Germans said they experienced a barrier to care because of cost in the past year, compared to 33% of Americans.
That's crazy.
Citizens really like it.
That is crazy. Look at that. All those countries, and none of them have a higher GDP than America.
Right.
Or the United States. I know people don't like it when we say America. Than the United States. And it's just ridiculous.
Yeah.
In the past year, compared to 33% of Americans.
The citizens really like it. They like the fact that everybody is covered. They like the fact that the costs are totally predictable. You know what it's going to cost you and how much your insurance company is going to pay you before you walk in, unlike the United States. They think it's normal that the insurance company pays every claim. They can't believe that an insurance company might deny a claim. And they think it's normal that they get to choose the doctor. They don't understand America, where the insurance company says, we won't cover Dr. Jones. You have to go to Dr. Smith instead. So the main thing I learned in going around the world is you have to make the commitment to provide health care for everybody. That's the destination. It turns out there are many different routes to that destination. I found the Canadian model, the French model, the British model, the German model, they all get to this goal in different ways and different models. So I don't care what the model is. I think it's important that you make the commitment to cover everybody. And this is something the world's richest country has never done.
No.
That's a damn shame that they've never done it.
But I love that everyone else has made that commitment and just found a way to do it.
Yeah.
And that's why.
Because that's what's important.
Right. And we watched a video a long time ago where it was hard to compare the United States to all these countries because they're all different.
Right.
Or to Europe because every country is different. So we understand that now.
Right.
Now that we've done all these videos and have learned so much about how each one is different. But ultimately, the oomph or the backing behind it is that they care about their people.
The ultimate goal is that they care about the ultimate driving factor.
Yeah.
Is that they care about their people.
And are going to find a way, and they just find their own unique ways, whatever works for that particular country.
And I would say, although there's some people in America, politicians who care about the people, the bottom line is the country itself does not. I mean, if they had to choose between a major corporation getting some health insurance or something like that, having a certain profit, and grandma dying, then I can guarantee you which one they're going to pick. So, which is just crazy because I have people in our lives. I mean, we all do. Well, I have people in our lives who are older who are relying on some kind of help.
Right.
And unless one of their kids or grandkids or somebody has hundreds of thousands or millions of dollars to help support them, or you've been paying long-term care insurance for years and years and years, I mean, you're screwed. So, but all that being said, we know that there's faults. So that's where you come in. You can let us know, like, what are we missing here? Are there some faults that's happening here? Reasons that people don't like the system, would prefer to have the system in America. That can't be an option. All right. Okay.
Yeah.
Okay. Let's just go ahead and read this here. What the people got to say? Being German, I can't imagine what it must be like to think about money before calling for an ambulance. That's
true.
Totally nuts.
Mm-hmm.
It's ridiculous.
I remember one time when our oldest was little, he had a fainting spell, and we don't know what happened, but we did call the ambulance. But then we chose, they helped him, but then they offered to bring him in the ambulance to the hospital, and we chose to just take him.
Yeah.
And he was kind of, on the right there. He was getting ready to pass out again and stuff like that. But that happened to us.
Yeah.
That we made that choice to just quickly take him ourselves because of the money.
Yeah, and I'm not gonna lie. Like if the procedure that I had was $24,000. If I would have known that, I don't know. I would have done it. I would have tried to find another way.
Yeah, we would have just done the cheap one, or the one that was covered, that we knew was covered.
Can you believe that, Germany? I was paying $1,000 a month for two of us. Well, we were paying $1,000 a month. I had a procedure that wasn't even a surgery or anything.
Yeah.
It was just them putting some dye in my veins to see if I had any blockage in my heart and a couple other things, or ultrasound and things like that. But
it was that procedure that cost $20.
Oh, it was that procedure?
It was that procedure.
Okay, yeah. They put some dye in my veins. And it was $24,000.
22.
22. And the reason it was 22 was because the insurance company denied it and said, we're not doing that. You could have done the cheaper version where you weren't more certain that you were that it actually worked.
Yeah.
All right, we better go because these people are probably like, okay, we get it. We get it.
Yeah.
All right.
Okay.
As always, thanks for stopping by, and we will see you on the next video.
Bye.
Peace.